Usually a cut is made in the skin horizontally along the bikini line, a few centimetres above the pubic hairline. A horizontal incision is performed most commonly because there is less pain after the procedure and the wound heals very well. Occasionally, a vertical or midline incision is required if the cesarean section is likely to be complicated. After the abdominal cavity is entered, an incision, a cut, is made in the uterus. Usually the incision is horizontal or transverse. Once the uterus has been cut, the amniotic fluid around the baby, starts to drain. You may notice a sucking or slurping noise as the amniotic fluid is being sucked away from the operating field. The baby is usually delivered head first. Forceps are sometimes needed to assist with the delivery of the head. If the baby is presenting breech, the baby will be delivered bottom first. With twins, the baby who has been coming first will usually be delivered first. The placenta is removed and the uterus checked to ensure it is empty. The uterus and abdominal wall layers are closed with dissolving sutures, and then the skin closed with sutures or staples. A clean dressing is applied over the wound, and it will then be transferred to the recovery room. Observations will be taken of your blood loss, blood pressure, pulse, and temperature for a further 30 to 60 minutes. You may experience some cramps during this time or experience some nausea. The staff in the recovery room can give you medications for this if needed. Your legs will be numb for several hours after a regional anaesthetic. You will leave the recovery room to be with your baby in the postnatal ward when your observations are confirmed to be stable and you are comfortable. The wound will require a dry dressing for about a week. In most cases, the wound is closed with dissolving sutures, which means they do not have to be removed. Occasionally staples or non-absorbable sutures are used. These will usually be removed around day 5 to 7, depending on the type of abdominal incision used. The skin will heal over in the first few weeks, but numbness over the scar area may persist for several months. Any abdominal surgery can result in damage to surrounding organs such as the bowel, bladder, or blood vessels. The risk of damage to these organs at planned caesarean section is approximately 1 in 100. The risk is higher if the caesarean section is particularly difficult, especially if there is a lot of scarring from previous abdominal surgery. If damage is done to one of these organs at the time of your surgery, this will be repaired. This may require an increase in operating time, making a larger abdominal incision than originally planned, increased blood loss and need for transfusion, a longer recovery period and hospital stay. There is a slight increase in the risk of serious infection with planned caesarean birth compared to planned vaginal birth. This infection most commonly comes from the wound, bladder, or lining of the womb, endometritis. You will be given antibiotics at the time of the operation to lower the risk of infection. It is important to tell your doctor if you notice any of the following after your caesarean section: a fever, redness, swelling, bleeding or leaking of fluid from the wound which might suggest a wound infection, burning, stinging or frequent urination which might suggest a bladder infection, excessive vaginal bleeding which becomes bright and heavy, having previously been lighter and darker, which might suggest an infection of the lining of the uterus,